This conference will now be recorded.
Perfect. Well, thank you everyone for taking time out of your schedule to log in today. I know that this is a very unique time for all of us, so I appreciate your flexibility with the IT issues and things like that, but I certainly hope that this is a very good discussion and very educational for everybody. My name is James Batega. I'm one of the research administrators with Prime. This is a educational activity that is sponsored through educational grants from both AbbVie and Gilead Sciences, and we are very happy to have partnered with the Hawaii Department of Health and Hep C Hawaii. So with that said, I will mute myself and hand everything over to Melissa, and from there you will take it. So I really appreciate it.
Thanks, James. So just a little bit of housekeeping. If you're just joining us, if you wouldn't mind taking a moment to mute your microphone so that background noise won't interfere with the recording of the presentation. I'm so excited to welcome you all tonight. My name is Melissa Bumgardner. I'm the Director of Pharmacy Services at West Hawaii Community Health Center. We are located on the west side of Hawaii with our main office down in downtown Kona. And joining us this evening is Thaddeus Pham, who, as James mentioned, is one of the co-directors of Hep C Hawaii. That's how I know him best. But he does other things for the Department of Health and Hawaii Health Harm Reduction Services, and he's my go-to guy for all things related to hepatitis and harm reduction in the state of Hawaii. So tonight, I'd love, if you haven't already, if you could just drop a quick message in the chat box for Thaddeus, indicating if you're a patient, a provider, a caregiver, or something else, a friend of someone, so that we know who's joining us this evening and can make sure we kind of direct our comments appropriately to our audience. Well, give me 1 second. It decided not to let me advance slides. There we go. So just a little bit finishing up the housekeeping. We know that there's a problem with the pre-survey, but after the session, there are some links that you'll be able to click on to take your post-survey, and James will chime in and let us know what to do about that pre-survey at the end. And it gives you some instructions on how to make sure you get your incentive. So for patients, non-patients folks, you get the $20 gift card for Amazon, and my colleagues from the health center, you get CME, which is really valuable. So we are going to be talking about quite a different things related to Hep C today, including what it is, who should be tested, what to do if you turn out that you have the infection and how we treat it. And then in general, just talking about how to protect your overall liver health and how to get support for either yourself if you're the patient or for your friend or family member. So the ABCs of hepatitis, there's actually 5 kinds of hepatitis, but in our country, we deal only with A, B, and C. And so we're not going to talk about D or E tonight. But if you look here, you'll see that there's some differences between the 3 types that we face most commonly in the United States. Type A comes from contaminated food and water. And we actually had an outbreak when I very first moved here about 4 years ago, where all the pharmacies were doing a lot of vaccines to help protect patients from that infection. And you can see there is no cure, but there is a vaccine. And it's not a super serious disease. It's really kind of self-limiting. Hep B and C are more common here than other types of hepatitis and are the ones that can progress to the more serious disease. While we don't have a vaccine for Hep C, this is the only one for which we have a cure, and that's what we're going to be talking about later in the presentation. So I've thrown the term Hep C around quite a few times. What is Hep C? Hepatitis C, well, hepatitis itself is liver damage that can make your liver not work the way that it's supposed to. Hepatitis C is just the disease that can harm your liver. It's caused by a virus called the hepatitis C virus, which we will henceforth refer to as Hep C. It's a serious disease, but it does not have to be life-threatening. And as I mentioned, this is the only type of hepatitis for which we actually have a cure. If you already have Hep C, there are a lot of things you can do to protect yourself, keep yourself healthy, and as we're going to talk about, take medications that can actually cure the disease. Hep C might be as common in our state as it is in other states, but I was looking at a map this week about how the prevalence of hepatitis C throughout the country, and Hawaii is one of the highest states for liver cancer, which is the most common complication, or the worst complication that you can have from Hep C. So this is part of why we're doing this presentation today, to help prevent liver cancer. All of the members of our healthcare team, including pharmacists, nurses, medical providers, folks like Thaddeus from Hep Free Hawaii, we can work together to prevent liver cancer and hopefully eradicate hepatitis C by 2030. That's our goal. Since we're talking about hepatitis, we should spend just a little bit of time talking about the role of the liver. It is the largest organ in your body, and it's like a super house. It does so many different things that are important to your functioning. So if you take your left hand and you put it under your rib cage, y'all want to touch your belly really quick. Right under that hand will be your liver. So it's right under your ribs on the right side of your abdomen, and it does all these things that you see on the slide. One of the most important things is to filter your blood and remove toxins like alcohol and drugs. As a pharmacist, I spend a lot of time dealing with the effects of the liver on the way medications are processed. And when your liver isn't working properly, the impact that can have on the way medications work. It also helps your blood to clot normally. It stores vitamins and other nutrients that are important for your health. So what does Hep C do to the liver? If you look at this progression here, healthy liver on the left and the worst case scenario, liver cancer on the right. So the term hepatitis, if you break that down to its parts, the medical term hepatitis, hepat refers to liver and itis means inflammation. So Hep C causes liver inflammation, which can then cause scar tissue to form in the liver. The scarring is called fibrosis. So that's that orange colored area that you see on the slide. And it can prevent your liver from doing its job of filtering the blood and making your blood clot properly and storing vitamins. If there's a lot of scarring, the liver actually becomes really stiff and yellow and bumpy. And that's the red picture you see there, where we actually call that cirrhosis. Too much scarring can lead to liver failure or even cancer. So the longer that someone lives with Hep C, the more likely that that person is to develop serious liver disease. But if we catch it early and we treat it, because we now can cure it really quite simply, then liver damage can be stopped and in some cases even reversed. So in our country, hepatitis C is the #1 reason that a patient needs a liver transplant. And as I already mentioned, it's one of the leading causes of liver cancer. So if you look at 100 people that have Hep C, 60 to 70 of them will go on to develop liver disease. And of those 60 or 70 patients, 5 to 20 of them will actually go on to develop cirrhosis over a period of about 20 to 30 years. So let's take a closer look at the timeline that I kind of just referenced. When a patient is first exposed to Hep C, and thinking back to the ABC slide, Hep C is transmitted between people by the blood. So when the patient is exposed to blood that has Hep C, and they actually acquire the infection, 1 to 3 months after the exposure, about 25% or 1 in 4 patients will experience symptoms of acute infection that can last for several months. The problem is the symptoms are really kind of non-specific. So if you look at that red triangle there labeled #2, they feel tired, may have a poor appetite, have some joint pain. They may have that yellowish tint to their skin or the eyes, but might not always notice that. So they may very well not even know that they've been infected with Hep C. And here's where we get to the part where we call Hep C Assignment Disease, because once that patient goes on to have chronic infection, meaning it's long-term or permanent, they don't have any symptoms at all. And they can last for decades with just small amounts of inflammation, scarring and damage happening over time. So it really is a silent disease, and most people who have hepatitis C do not know they have it. So while not everyone will go on to cirrhosis, the number 4 that you see there, or even liver failure or cancer, that's in the past, we did not know that people had Hep C until they got to that stage where their liver was really severely damaged. This is why early testing is really important. Here's the good news. For some patients, their body can actually fight off Hep C all by itself without any intervention from a medical team. So essentially, about 3 out of 10 people who become infected with hepatitis C will fight it off on their own and go on to not have chronic infection. But 7 out of 10 will have chronic infection. And of those 70%, 2 to 4 of those will go on to develop that cirrhosis that we talked about. Once you have chronic infection or long-term Hep C, the only way to get rid of it is with medication. And we'll talk later in the slides about those medications and how they work to help cure Hep C. Next, you might be asking, well, who's at risk for Hep C? And really, you can say all adults. But we'll go through each of these different categories of risk types on subsequent slides. We used to only screen those patients that were on this slide, and we'll talk more about how we've changed that recently. But our baby boomers, so sorry, apparently my phone was not on silent. 1 second. There we go. Our baby boomers who lived an enjoyable and exciting time in their younger years, expose themselves to lots of things you see on this slide. And they have 1 in 30 baby boomers, which are anyone born between 1945 and 1965. It has Hep C, and again, most of them don't know that they have it. Because Hep C is spread via the blood, a lot of people in the United States get Hep C by sharing needles or other items that they use to inject drugs. So if you've ever injected drugs, even if it was one time or a really long time ago, you should still get tested for Hep C. It can also be spread by snorting drugs, like snorting, because if the person had a bloody nose or cracked lips, then the equipment that was used to smoke a crack pipe or snort the cocaine could, like if they use a straw, then it can be transmitted that way. It's also possible to get it through tattoos and piercings, and we'll talk more about that on another slide. You might not know that prior to 1992, the blood banks actually didn't screen the blood that they were transfusing for these infections that could be transmitted via the blood. So people who received transmissions prior to 1992 actually can have acquired hepatitis C through that route. And I have myself cared for about a half a dozen patients who that was the only source that we could identify as the source of their Hep C. While Hep C is not spread through semen and vaginal secretions like hepatitis B is, there are still risks with sex if the persons are exposed to blood during intercourse, and we'll talk about that in a little more detail. So right now, the 3 in 5 adults in Hawaii who've ever injected drugs have Hep C. And people who inject drugs are at the highest risk of getting Hep C now. Hep C is spread by any equipment that is used to prepare and inject the drug. So it's not just the needle and syringe, but the cotton or the cookers or even the rinse water can become contaminated and spread the virus. Even using the noodle just once, even again, if it was a long time ago, can put you at risk of having Hep C. So what we found is that injection drug use is most significantly associated risk factor with Hep C among community-based testing programs here in our state. We're seeing a huge surge in Hep C in young people. If you look back, we only have numbers going back to 2013 right now, but between 2011 and 2013, so in just 2 years, there was a 20% increase in patients with that were under 30 that were Hep C positive who were active drug users via the injection route. Tattoos. So we're in Hawaii. And we love our tattoos. We love our tribal, and it's part of our culture here. So the studies have shown that there's no evidence of higher risk of getting Hep C infection if you get your tattoo or your piercing at a professional parlor, because they are licensed and certified and they're required to use clean equipment, new sterile needles, gloves and hand washing, those kinds of things between every patient. The risk comes for our friends and family who get their tattoos or piercings from their friends and family, or who get them in jail or prison. So I would like to draw your attention just over here to this leftover ink. So when I talk to people about their tattoos, or they ask me about how to get a safe tattoo, they always pay attention to they opened the package, they gave me a new needle, I saw all of that, but my question is about the ink, because you might not think about that. If that new needle is going into old ink, then the infection could be transmitted in that way. There's another group of people who are at risk of transmitting or acquiring hepatitis C, and that deals with pregnant women and their unborn children. So if you're pregnant or planning to become pregnant, the best thing to do is talk with your doctor about getting tested for Hep C, because if you catch it before pregnancy, we can treat it and cure it, and then the unborn child will be 100% protected from acquiring the infection. Hep C treatment is not recommended during pregnancy, but it's still important for women who are pregnant to get tested for Hep C, because then their doctor can monitor their liver during the pregnancy, and the baby can get tested for Hep C after birth. Babies who are born to women with Hep C should get tested when they're 18 months old, and we do have treatments that are now approved to treat children as young as 12, depending on their weight. The good news is that hepatitis C infection does not spread through breast milk. So mothers with Hep C can safely breastfeed their child as long as their nipple is not cracked or bleeding, or if they're not co-infected with HIV. I've shared a lot of information in a brief period of time, so I want to pause to see if we have any questions. Are there any in the chat, that is?
No questions in the chat. Just wanted to reiterate for folks, the pre-survey option didn't work. So Prime Education is going to follow up to make sure that everyone gets either their CEs or their gift cards. And then just to give you a little context, Melissa, you have a pretty good mix of patients, staff, and other people who are interested.
Just to really briefly let you guys know, and I'm sorry to jump in real quick, I will send out links for providers who need their surveys for credits, as well as patients that need their surveys for the gift card. So I have links that I'll send out in the chat function at the end of the presentation. So sorry about that, guys.
Thanks, James. So just to clarify for them, they'll be able to take the post-survey immediately after and then do the pre-survey later, so just be a little backwards?
Correct, yes, yep. So, and then I'll also share my email address in case there's any other IT issues, to make sure that everyone gets their credit and gift cards appropriately.
Excellent, thank you, James. We really appreciate that. Okay. Any other questions before we move on? And you can unmute and ask verbally, or just put it in the chat box for Thaddeus. Okay. Hearing none, I'm going to move on. Sorry about that. Little trouble. There we go. Now that we've established what is hepatitis C and what are the risk factors for acquiring hepatitis C, the real question is who should get tested. And the really easy answer is everyone. This year, both the United States Preventative Services Task Force and the Centers for Disease Control agreed, for like the first time that I can remember, on who should be tested. And they agreed that it should be pretty much every adult. So specifically at our health center, we now have a health reminder to screen all patients who are between age 18 and 79. I guess when you turn 80, the CDC isn't quite as concerned, but the USPSTF does say screen all adults at least once per lifetime. And then we screen periodically for those patients who have the risk factors that we saw on the previous slide. It's important to know that just because you might have tested negative for Hep C in the past, or you've even been treated successfully for Hep C, or have antibodies for Hep C in your blood, it doesn't mean that you shouldn't get tested again. If you have a risk, such as actively injecting drugs, is just one example, you should get tested for Hep C every year. If you think you've been exposed to Hep C, get tested. Being infected in the past and even being treated and cured in the past does not prevent you from getting infected again. It's important to note that. The other thing is that the sooner we know that you have chronic Hep C infection, then the sooner that we can get you access to treatment and also make some healthy lifestyle choices that can help protect the health of your liver. The nice thing is that some places can do a rapid test with just a poke of your finger and give you results in about 15 minutes, or we can do a blood test that's taking blood from a vein. Here on our island, on our side of the island, HIHAF, which is Hawaii Island HIV/AIDS Foundation. Yes? Okay, HIHAF. They're located over off of Palani, just behind the Taco Bell, in that building that has the chiropractor office also in it. They can do, I believe they do a rapid test. Is that right, Thaddeus? Do they do the finger? Yep. At our health center, as I mentioned, we are ordering that screening test for all adults, but we just order it at the lab for you. I want to point out your focus on this right here, where it's going to tell you if you've ever been exposed. So there will be subsequent testing that may be required if you test, quote, have a reactive test for this antibody, because an antibody just shows us if you've been exposed to the virus. It doesn't tell us if the virus is currently in your blood or not. That's where it brings us to this, what happens next. So if you test positive or have a reactive test to Hep C antibody on either the finger poke or the one that's in your the venous blood draw at the laboratory, there's additional testing that is going to be ordered. And the first test will be what's called an RNA test. And all that is looking to see how much virus, if any, is in your blood. If you test positive for the antibody and negative for the virus, it means you don't have chronic hepatitis C infection. It just means you've been exposed to it, and you're one of those lucky 3 out of 10 where your body cleared the infection all on its own. At our health center, if you get that positive antibody test and then also have a positive virus test that tells us that there's actual virus in your blood, then we will start doing all of these other things for you. But for you personally, what you can do is really focus on making sure you don't spread that infection to other people. Since it is in your blood, we want to make sure you limit contact with your blood to others. And we'll talk about that in more detail in a few minutes. And then we also want to test you for other viruses that can be transmitted via the blood, like HIV or Hep B. And we will test you for Hep A and Hep B. And if you are not immune or have not been exposed to Hep A or Hep B, we would recommend that you receive the vaccines for those, since we have those available. How do you find a hepatitis provider? You go to your nearest West Hawaii Community Health Center, because you're here and we treat. So I am the pharmacist in charge of coordinating our hepatitis treatment program at the West Hawaii Community Health Center. We have providers at all of our health centers who have experience in treating hepatitis C, and we can take really good care of you. If you're joining us from another island or another state, there's resources here that can help connect you with providers in your location where you can access treatment. So I mentioned a few slides ago about the importance of avoiding spreading the hepatitis C virus to those around you once you know that you have active virus in your blood. Unfortunately, hepatitis C is very hardy, and it can live and survive on surfaces for up to 3 weeks. So first, if you cut yourself or have an injury and you have visible blood, you want to clean it and cover it. It's recommended to use a 10-to-1 bleach solution to clean blood off of any surface if it gets on a surface. but it's also important to think about things that you use every day that might have your blood on it in very small amounts. And that includes nail clippers, toothbrushes, and razors. We actually had one of our patients who was a young woman who acquired her hepatitis C infection by borrowing her mother's razor. Her mother didn't know she had hepatitis C. She was a baby boomer. And both mom and daughter discovered they had hepatitis C simultaneously. The good news is that it is a blood infection. It cannot be spread by just hugging or kissing or sharing food or even sneezing in the presence of someone. This is not coronavirus, okay? You can hug if you're not socially distant and they're in your home and you're not quarantined and all of those good things. It is only blood things that you need to be concerned about. So if you have Hep C, please don't stop hugging your family and folks in your household. I mentioned earlier that Hep C is not in semen or vaginal fluid, but it is in the blood. So while it's not spread as commonly via sexual intercourse as some other infections, it can be spread in that manner. And it's higher incidence of that happening in people who use drugs while having sex, have sex with multiple partners, or have rough sex that can result in bleeding, or if they have other sexually transmitted infections. So on this slide, you'll see a couple of things that you can do to protect yourself and your partner from transmitting Hep C, or if your partner is infected and you are not, these are things that you would want to do, especially wearing a condom. And like that's important no matter what, especially if they're using multiple partners, not just for hepatitis C, but for other sexually transmitted infections. If you are someone who is currently injecting drugs, I would implore you to please not share your needle. So our friends at HiHab not only can provide testing for hepatitis C and other infections, but they can provide you with needles via needle exchange. Please use a new clean needle every time. That's the best thing that you can do to protect others from acquiring that infection, but also then disposing of your needles safely. So at our health center, we do have free BD sharps containers that we can give you. We'll just give it to you. If you don't have access to get to our health center or you're not currently our patient, you can make your own sharps container with any hard plastic container. Put your used needles in there. And so thinking like a bleach bottle or like a laundry detergent bottle, put your used needles in there. When it's all full, put some bleach water in there, drain the water, seal it up really good, and it goes in the regular rubbish in our state. We don't have a special place to dispose of used needles other than protecting our rubbish workers by putting it in a hard plastic container. If you're using your own, please write biohazard on the outside. And then, of course, we'd love you to please get tested and seek treatment. When we talk about the medications, these medications actually are shown to be effective even in someone who's actively still injecting drugs. And we would love to help. As I said, our goal is to eliminate Hep C by 2030. So we'd love to get you treated. But all of us, whether we have Hep C or not, can protect our liver by taking a few of these steps. So if you do have active Hep C infection, one of the most important things you can do is stop consuming alcohol, because alcohol is seen by your liver as a toxin. And so it's going to be working really hard to try to get rid of that. And we want it to work really hard on getting rid of Hep C instead. Please get tested for both Hep A and Hep B, because those are other liver diseases that we can protect you from. If you're not currently immune to those, we can give you a vaccine and help you with that. And then, because I'm a pharmacist, I would ask you to consult with me if you come to our health center, your local pharmacist or your regular provider about what medications are safe for you to take. Your liver's job is to deal with toxins. And while we think medications are good, your liver thinks they're toxin and it needs to get rid of them. So if your liver is not healthy, we want to make sure that you stay safe by taking medicines that are safe for you. And then you can access some resources from the American Liver Foundation. Remember, you'll have access to these slides afterwards to get those links and get other resources. So if If you're not currently a patient who knows they have Hep C, or you're a caregiver, or you've never been tested, just thinking for a moment how you might feel if you found out you had hepatitis C. Would you be worried about telling your friends and family? Many patients, and even now, there's a big stigma surrounding hepatitis C because people think that it's only a disease associated with people who inject drugs or something like that, when it really isn't. There are lots of ways that hepatitis C can be spread in the community, but people may feel ashamed or scared. So it's important to know that no one deserves to have Hep C, and there are steps that you can take to protect your loved ones and yourself, one of which includes getting treated. If you've been recently diagnosed with Hep C and you're struggling with some of these feelings about that diagnosis, we really encourage you to seek help. Again, at our health center, we have a whole team of folks whose whole job it is to support you in that area, and we would love to help connect you with them. It's just important to remember that Hep C may be a part of your life, but it shouldn't control your life. Here are some really cool resources. I was checking out this Help for Hep. They actually have remote support where you can get personal support, since we can't meet in a group of greater than 10 people right now. There are really great options because I was not able to find any actual face-to-face support groups on our island. Thaddeus, can you comment? Are there any in West Hawaii?
No, nothing to know of. And even on Oahu, we don't have any more. I think it's since the treatments have gotten easier, less people came to the old support group, and then it kind of just went away. But I think we're thinking about maybe starting some, and maybe we could work with you folks if you need to start one too.
Absolutely. I think we would love to do that at some point when we're all allowed to gather again without a mask. So those of you at the health center who've maybe never seen my face, no mask. I digress. I miss people and being together in a room where you can see the smiles. Let's take a pause before we talk about the cure for Hep C and see what questions might be in the chat box or that you might have, and you can unmute and ask that.
So Melissa, there's no questions in the chat box right now, but I did post a couple things that you had mentioned. So there's a searchable map for local Hep C rapid testing sites for Hawaii, and there's a searchable map for Hep providers across the state, which includes West Hawaii Community Health Center. So thank you.
Thank you, Thaddeus. All right, well, let's get to the good news, which is, can Hep C be cured? And the answer is yes. So when I was in pharmacy school a really long time ago, yes, I'm older than I look. The treatment we had for Hep C was awful, and I think it was worse than the infection itself. But the new treatments, that the very first one was approved in 2011, directly attack the virus and have an incredibly high cure rate, like 97 out of 100 people who take the medication as directed every day can be cured. That means the virus is gone. It's POW. It's gone. It can no longer damage your liver or be spread to others. This is it's one of the most rewarding things I think I've ever done in my career, which is we can have a chronic disease that we can actually cure. And at our health center so far, since we started treating about 16, 18 months ago, we now have 30 patients who are cured. Oh, 31. So you might ask yourself, well, should I treat now or can it wait? And what I would say is everyone should be treated, and we should do it now. So a couple of years ago, MedQuest, which is the organization that oversees our Medicaid program, removed restrictions for access to the medication because the medications are rather pricey. I will be very upfront about that. They no longer are restricting based on how sick your liver is. So it doesn't matter what stage of fibrosis you have. And it doesn't matter if you're currently using any kind of substance, including alcohol. MedQuest, you cannot be denied treatment for these reasons. So starting treatment early is really important. The sooner you do it, the less scarring there is, the lower your risk of liver cancer. And the most important thing is you and your emotional and physical well-being you would be cured and no longer have this infection that you may have been concerned or worried about affecting others. It's amazing. It's really awesome. So we say get treated now. This is what's new. So I talked about the old days. Interferon was a shot that you had to get every week for somewhere between 6 months to a year, and it didn't kill the virus. It didn't work very well. So you went through these shots. It had horrible side effects, including suicide, depression, and then it affected your heart system, your immune system, your brain. It was awful stuff, and it only worked in like 3 out of 10 patients. So we don't use that anymore. All of the treatments we have now are oral, and it's one to 3 pills a day. You treat for 2 to 3 months, and as I already mentioned, 97 out of 100 people in general are cured with this treatment. And there's only 2 main side effects. It can cause a headache, which I think is a side effect on like every medication that we have in our country. And the other thing it can cause is fatigue. And fatigue is actually a symptom of chronic hepatitis C infection. So it's hard to know, is it the treatment or is it the infection? And of the patients we've treated, about half of them have reported having the fatigue, and the rest have said they felt great. So it's actually pretty easy. And like Batega said, I think that's why there's not the support groups anymore, because we can cure you and we can do it pretty quickly. So the options now, generally, there's only 2 medications that we use anymore. And that's because these 2 medications work for all of the types of hepatitis C virus that exist. They work very effectively. They have few side effects, and the treatment regimen is pretty short. So this is mostly what we use at our health center, is these 2 medications. And then if for some reason you were one of that 3 out of 100 people, or for some other reason you did not achieve cure at the end of your treatment, there are other options. There's actually, I think, 12 total different medications that are approved for Hep C. So you just may need to take more than 1 medication and take it for longer than the 12-week period. I should mention that even if you were treated before, so if you've had hepatitis C infection for a long time and you were one of the patients that had the interferon or ribavirin back 10 or 20 years ago and it didn't work for you, you can still be treated with these oral medications, but again, you would likely have to do more than 1 medicine and for a longer period of time. So I mentioned this already, that there should be nothing that prevents you from accessing medication if you have insurance. That all of the insurance plans do require what is called a prior authorization. So at our health center, we do that part for you. We fill out all this paperwork and explain to them why you need the medicine, because the medicines are very expensive, but you should be able to access it if you don't have insurance. There are programs available from the manufacturers that help support this talk that you're having today. So both AbbVie and Gilead have patient assistance programs, and we can help you access that as well. So there shouldn't be a reason that keeps you from getting treated for hepatitis C if you should have the infection and desire treatment. During treatment, there's a lot going on. So the important things are to make sure you take the medication every day as it's prescribed, because the medicine won't work if you don't take it. If you're experiencing side effects from the medications, you want to let your provider know right away, because there are things we can do to help with that. You want to protect your liver, so eat healthy. Try to avoid alcohol if you can. If you're having trouble with alcohol, there are treatments that can help you with that as well. And move, be active. That's part of helping your body to heal. And then make sure you keep your appointments so that we can follow. There are laboratory tests required as part of your treatment, and we want to make sure that the medicine is working for you. Here's the thing: when you come to see your medical provider, oftentimes there's a lot going on when you get to that visit, especially if you're coming to the health center. So now, before you can even get in the health center anywhere, You've got to be screened outside, get your temperature taken, answer a dissertation about where you've been before you came to see your provider. And you may be a little flustered, the waiting room may be warm, or can't even find a place to sit because all the chairs are blocked off to keep you 6 feet away. By the time you get to your provider, you've had your weight taken, your blood pressure taken, you've seen probably 3 other people, and they get in the room, they're running late, it's already been an hour and you forgot all the questions you had. So we recommend that you write down all your questions and concerns so that you don't forget anything. That you consider taking someone with you if your provider allows that. And some places, unfortunately, because of coronavirus, are not allowing that. That you be upfront with them, be honest and open with any questions, or if you don't understand something, if they're using terms or words that you don't know what they mean, go ahead and ask. And if you run out of time, ask them, who can I talk to afterwards? They have medical assistants or support staff that may be able to help answer your questions if the medical provider isn't able to do that at the time of the visit. So again, I'm the pharmacist. My job is to make sure you take your medication. One of the medicines that we use for treating hepatitis C comes with this really cool packaging that helps you remember if you took it. You can push out a little day of the week button to make sure you took it, and it comes with all the pills and a little push out thing. If you're not taking that one and you're taking one that comes in a bottle, we recommend you use something like a pill box to keep track and make sure you took the medication as you were supposed to. I always talk to patients about using their cell phone, and there's apps that you can get that can give you reminders, set an alarm. The Hep for Help for Hep that I was talking about several slides ago that has a support group actually has an app that has really neat things that can help you be successful in your treatment. We live in Hawaii. It's warm and humid here. So I would ask that you don't store your medications in the medicine cabinet in your bathroom because it's even more humid there than anywhere else. If you don't have children in the house that you have to worry about, you can keep it on your nightstand or wherever you're going to take it, in your kitchen cabinet or something like that. But we do want to store it in a dry place. Notice it doesn't say cool because you might not have a cool place here if you don't have air conditioning. As I mentioned, most patients should be able to get cured from Hep C. If you're not cured, there are options to continue seeking a way to help you achieve cure. So it's not over if you don't get cure on the first try. If you get reinfected with hepatitis C because maybe you're still engaging in a risky behavior, the second time it may be longer to get to cure. It may cost more because, as I mentioned, these medicines are very, very expensive. Think in the $100 to $1,000 per pill range. Yes, it's that expensive. So your insurance company may only pay for treatment once in a lifetime, and then you have to get more creative to get you access to the medication. So we would ask that once you get cured of Hep C, that you make healthy lifestyle changes that can help keep you cured from your Hep C. So I think we're at the end, yes. So this is more of the interactive part. I'm curious about how many of you might plan to get tested for Hep C now that you've learned more about it. Put a little, I don't know, on this one in Zoom, you can put like a like or a high five or something. I don't know if you can do that in GoToMeeting. Drop over in the chat box and say, yes, I'm gonna get tested. Yes, I know where to go. What questions do you have about all of this?
So no questions yet, Melissa.
Okay. So let me show you a couple of things. These slides will be available in the slide deck at the end when we finish. After the session, these links here, Thaddeus, are they in the chat box where the patients and participants would be able to just put them?
Not yet, but I could put them in there. And we got some comments. One person, said they're case manager for houseless youth. And so they get tested once in a while. And then someone had a question, do they test all pregnant women now?
Thanks for asking that, Tabitha. They do. It's part of the panel of tests that we do for a woman once she gets a positive pregnancy test. We test for a lot of things, and Hep C is one of them. Thanks for asking. Trying to advance, there's one more that I wanted to show you guys. So I did use when you're talking about hepatitis C with your medical provider, there are some terms that they might discuss in the room. So we have this resource here to help you understand what some of those testing terminologies mean. And again, you'll be able to access this after the fact. And these are all the things that we throw around these medical terms without always remembering that our patients might not always understand what we're talking about. So these are going to be available at the very end of the slides so that when you are ready to talk with your medical provider about your liver health, you'll have these resources to be able to do that. I'm going to zip back over here to this one. We have about 15 minutes. Yeah, we have about 15 minutes left in the session. Awesome. Yay, Grace. Sorry, I have the chat box open. Grace says she would like to get tested. So yay. I'm going to hang around. I'm not going to go anywhere, so that if you have questions and maybe you just didn't want to ask in front of a big group or something like that, we'll be here to answer those questions for you. And Thaddeus or James, comment on what happens now.
Yeah, so sorry about that. So I'm in the post box right now, or in the chat box right now. I also just posted the links. I know there were some issues with the pre-survey. So if you are a provider that requires credits for this, there's a specific link that you can click in the chat box right now. And if you're a patient that would like to provide your information to obtain your gift card, there's a link that you can click on there as well. And then that way, that's our kind of workaround because we had some IT issues. So I certainly appreciate everyone's flexibility. That's very much appreciated. We're learning to, do everything electronically due to the whole COVID thing, and I hope sometime next year we can get back to normal so I can get back to seeing some people's faces too.
We did have a question in the chat box that was asking would someone have pain under the right rib cage, possibly if they were affected with Hep C? Thaddeus, do you know the answer to that? I don't think so, but I don't know if you know.
Yeah, typically that's not one of the symptoms, I think, because I think the liver doesn't have nerves, right? So usually so you won't actually feel it in the liver, but it'll be the rest of the things that you mentioned, like jaundice and all that.
We're back to the awkward silence of remote
Oh, you have some more questions coming through too now.
Perfect.
Do they perform mandatory testing at KCH for drug abuse patients? What is KCH?
That would be Kona Community Hospital, which is the hospital closest to our downtown health center. And I honestly don't know the answer to that on whether or not they would test for Hep C in someone who comes in as a person who's injecting drugs. I don't know if they do that.
I can just share that usually it just depends on the provider, at least in the hospitals that we worked with. So I'm assuming it would be similar for Kona Hospital. Oh, there's a few more questions. What is the best thing a person with liver cirrhosis can do to support their liver health? Melissa, did you want to speak to that, or would you like me to?
So in my mind, it would be reducing toxin exposure. So reducing unnecessary supplement type products, alcohol exposure, that kind of thing. That's, as a pharmacist, that's what I would recommend. Thaddeus, what are your thoughts on that?
Yeah, I totally agree with that. Yeah, avoid toxins, which includes, as you mentioned, alcohol. And then just try to do all the stuff that people tell us to do. So try to eat healthy and try to exercise and do all that same stuff. Someone asked if someone has been vaccinated in the past and they never tested positive for A, B, and C, should they retest after each time they get tattooed?
Ooh, thanks for asking that question, Miguel. So again, I have my opinion, and I'll let Thaddeus contribute to that. If you got a tattoo at a licensed tattoo parlor that observed all the things that were listed on that slide, so new pack of needles, new ink, gloves, the place was clean, the need for testing is really probably not necessary, but I'll let Thaddeus contribute.
I totally agree with what you said, Melissa. So everything you just said. And it looks like that's all the questions in the chat right now.
Well, I want to be respectful of your time. Let's see. We still have about 10 minutes, but the formal portion of the session is over. So if you want to go grab dinner, go hug your kids, feel free to leave. I will not be offended in any way. If you have more questions or you're just kind of mulling over everything and processing and you want to hang out just in case someone else has a really great question or you think of something, we're not going anywhere. We'll be here for another 10 minutes or so. But thank you so much for coming. We really appreciate your time and attention on a Thursday night. And it was really our pleasure to be able to provide this for you tonight.
Thanks, Melissa. Great job. And Melissa, I'll stay on with you until 6:30 in case someone has any other questions.
Okay.
You're a really good presenter. You should present more for hepatitis instead of me.
I taught for 6 years at the College of Pharmacy in Minnesota, so that's the only reason I'm kind of slightly good at this. Thanks, guys.
Oh, that's great.
I recognize some of my patients over there. You know who you are. Thank you.
And then Lana asked, will the slides be available? So yeah, Lana, the slides should be available. I think, James, will it be on the same link where they do the post survey?
Yes.
Okay. So James, go ahead.
You were just going to say, I think what Joyal was saying, it didn't ask for the promo code.
So yeah, James, the promo code is just for the patient survey, yeah? Is that correct?
Correct. So the patients, after they complete the surveys, will get the promo code for the gift card, and the providers will get the CME credits.
So James, since we've experienced quite a bit of technical difficulties tonight, I know Emily has the email list, and were you able to see like who logged in that we might be able to assist these folks who?
Yeah, so I have first names.
Okay.
Unfortunately, so I can work with our IT team to see maybe with when maybe if they RSVP'd or if they completed something and that we recorded their email, which they can reach out, or if they can reach out to me directly, and I'd be more than happy to get somebody some help. Would it be beneficial if I put my email in the chat box for everybody?
Yeah, that would be great. And so Emily did not log in. She did say she's been building emails and calls and wasn't able to sign in. So I will let her know. Maybe she can reach out to you as well with folks who reached out to her to make sure everybody gets connected and gets their incentives for hanging out with us tonight.
Perfect. So in the chat box, I just put my email address. So it's my first initial J dot my last name at crimeinc.org. If anyone has any information or any problems with getting their credits or their gift card, please feel free to reach out to me, and I will do everything that I can to make sure that that's addressed appropriately. But I certainly appreciate everyone, logging in this evening and all their flexibility with our IT.
And Emily, our marketing representative from the health center, will be making that recording available, probably via our social media, maybe our Facebook page. I'm sorry, I don't know how to use social media, but Emily does, and so she will make sure that this is available and help work with folks.
Perfect. And I am seeing some people in the chat indicating that they were able to do both the pre and post survey, so that's great. But just in case people continue to have issues, please feel free to reach out and we'll make sure it's handled.
Kathy, Kathy's asking, where do we do the pre-survey? Did we direct her it so that up above in the chat? It's the same place, right? The pre-survey.
Correct.
And the...
Yeah. So, yep.
Mm-hmm.
So the link that I provided, we edited that link to make sure that you have access to the pre and post within that link, since there was that hiccup for the pre-survey.
Yeah, and I just clicked on the link too. So for folks who are trying to do it right now, if you look on the left, you can click on pre-survey, and then afterwards you can click on post-survey. From the same link. So and the slides, let's see. I don't see the slides yet, but I'm still taking the pre-survey, so it could just be after that. Let's see.
I think I think the slides have to be posted within the next couple of hours. If my memory serves me correct, I could be wrong, but I think that's normally how it works.
Oh, Valerie says she sees the slides.
So oh, perfect. Okay.
Hey, thanks, Valerie.
Thanks, Valerie. And thanks so much, James, for being so flexible and trying to help us problem solve all of this.
Absolutely.
Thaddeus, could you address the question in the chat from Blossom?
Sure. Let's see. If I have holistic liver support and detox resources, would it be okay to share them here in the chat? Yeah, sure, Blossom. I think like kind of Melissa mentioned, if you do want to get treated for Hep C, you always want to make sure to let people know what resources and detox things that you're taking as well. I've spoken with some of our holistic providers in Hawaii, and they've been really great partners. And they always say that what they do is they help keep the body healthy, but the medical providers and those other folks are the ones that actually get rid of the virus. So it's always good to kind of keep your body strong.
Thank you, Blossom, for making that offer. We appreciate that.
And I just confirmed, so after you finish the pre-survey, the presentation slides will be there, just like they were saying, like Valerie was saying. Yay. Yay. Listen, I think you got the most turnout of the summer so far for us.
Ooh, that's because of our marketing. So. I just give all the credit to Emily, and she's not here to know that, but I'll tell her later.
Please give her thanks from me and props.
She sent an email to 13,000 people.
Oh my God.
Once again, as everybody logs off, thank you so much for taking time out of your schedule to log in and chat with us about this very important topic. And please feel free to reach out to me with any other login or survey issues. Thank you, Melissa, for your great presentation. This was, I think, the largest presentation that I've at least been a part of. So that's great.
Sorry, just real quick, what was the passcode for after you do the survey to put in for the gift card?
It is capital. So it's all capital prime 2020. So it's prime PRIME 2020.
Okay. Thank you.
No problem.
And
And then James,
thank you. Thanks, Melissa. That was a really nice presentation to listen to.
Thanks for coming, Sarah Beth. It's good to hear your voice.
Have a good night.
You too.
and James, there's a comment in the chat. Grace said, please do these more often. So Melissa, we'll try to make sure that if there are more opportunities in the future, that we'll let you folks know as well. So you could do this for your community.
Yeah,
Great.
To be honest, I'm just fearful for the party part because all my elders are like 80s, 90s,
Right.
you know, and it's scary to have all them, you know,
Right.
and then what if
hear.
somebody had it
Wanna
infect
let
their
you know.
family and it's them, you know?
Oh, so let's say they come up with a vaccine by early next year, or let's say before summer, will you go through with your wedding in December?
If they come up with a vaccine and I know it's not killing people,
I think
and it's
someone's unmuted.
It's Heidi.
Yes.
you know,
And
Or in other words, if there's
Hello?
efficacy and you know it's going.
there she goes.
Hello.
All right, it's all good.
Great. So it looks like it's 6:30. So thanks again, Melissa. Great job. Yay.
All right.
And thanks, James.
All right, you guys have a great night, James. Sleep well.
Thank you all so
much.
much.
Thank you.
Enjoy the sunset.
I
Thanks.
missed it already. Good night, guys.
Good night, everyone. Take care.